Andrew Rubin of New York University's Langone Medical Center. He's also the host of Healthcare Connect on Sirius Satellite XM Radio, Channel 114. Good morning, gentlemen. Good to see you guys.
Good morning.
I apologize there. I was whispering to Andrew when Mr. Webster was sending it back to me because I was very curious. Andrew, what did you make of Senator Max Baucus's plan yesterday?
Well, it's interesting because I think this is where the money is. The president's got a big speech tonight, but I think the Baucus bill is really where you're going to see most of the action on health care reform. Some of the stuff that's coming out of it, some of the proposals kind of make sense, and whether or not Congress can come together and put it all together, we'll see what happens. But I think there's some good meat in there to start talking about.
Well, what's the number one thing you're hearing from people?
Number one question, unequivocally, is if I like my insurance now, and I'm summarizing all these calls, what does it mean for me in the future? Can I keep my benefits? The answer is maybe. So in the short term, if you work for a large employer, you're going to be able to keep your benefits as they are, assuming your employer wants to provide those same benefit packages. However, the legislation is written with time limits, and after a certain amount of time, if your employer's plan does not meet the criteria that's needed for this whatever benefit package the federal government puts together, then the plan becomes disqualified and people's benefits will change.
Well, I think they got it right. I mean, I think I would put it into two categories. One is that they're invincible, or at least they think they're invincible. And when you actually look at the healthcare statistics, most of these uninsured, healthy, I'm going to call them kids, are, stay healthy. It's when you get into trouble where it can be catastrophic.
Andrew, I want to turn to you. You are the healthcare expert here.
First, you have to give the Obama administration credit for what he has done, what they have done. They did introduce COBRA legislation that funds 2/3 of COBRA. They put $87 billion into the state Medicaid programs for children and adults who would have gone without insurance had the states not gotten the funding. And they put $20 billion into electronic medical records so that institutions can start talking with their doctors back and forth and improve quality, lower cost.
One of the biggest plans getting money right now, Medicaid, those S-chip programs, $14.5 billion of the spending that's gone out the door for stimulus has gone to that. Do you think that's really helping people out there?
I think it's keeping, S-chip is for children and keeping children insured in health care. Listen, anything you do to keep people insured with, insured, particularly children, is important. I don't think it's stimulating the economy. I think it helps the states fund these programs, and that's a great thing to do. I wouldn't really call it the first step towards health care reform.
Mr. Rubin, this must be a big deal, especially in rural areas where access to health care sometimes is a bit more inconvenient.
Well, that's an interesting comment. This may or may not really work in rural America because, again, you want to have that established relationship with your physician. So if it's, you don't want to race into your doctor's office to pick up a prescription, or you want to make an appointment, or you already know your doctor and you do have the sniffles that Nisa was just talking about, this may be a great way to avoid those long trips to the doctor and get some quick care. But again, key is you have to have that relationship established already.
Andrew Rubin is the host of Healthcare Connect on Sirius Radio. Good morning to both of you.
Good morning.
So listen, a lot of people are thinking about cutting their health insurance, basically not continuing it because of the fear that they can no longer pay their bills. Should they?
Absolutely not. I think Andrew can talk about that.
I think it seems like an easy thing to cut when the bills are piling up. The reality is health care insurance is the last thing you should cut. A typical hospitalization for a knee replacement, for example, can cost $30,000 to $50,000. That's before you even see the doctor bill. That's just the hospital bill. Where a health insurance premium could be anywhere from $8,000 to $12,000.
What are you seeing that American businesses are doing or should be doing when it comes to both wellness programs and also just disease management?
So a recent PricewaterhouseCoopers study that just came out where they surveyed self-insured big businesses. They're putting a lot of money into wellness programs, preventive medicine programs. Now they're a little bit skeptical about whether it's going to work, but they are putting money into it. So subsidizing gym memberships, smoking cessation programs, better eating, healthier food choices. They are putting money into that. And in fact, IBM is a recent example of a company that over 2 or 3 years invested, I think, about $80 million and saw a $190 million return on investment in terms of lower healthcare expenditures.
Joining us now with some more insight is Andrew Rubin, host of Healthcare Connect on Sirius Satellite Radio.